Welcome to the podcast. Today, I am joined by Dr. Steve Leuck, a pharmacist, author, and advocate in long-term recovery from substance use disorder. Steve's book, A Pharmacist's Story, An Authentic Tale of True Love, Family, Addiction, and the Practice of Pharmacy, chronicles his 7-year struggle with cocaine and opioid addiction, a battle he fought while wearing the pharmacist's white coat and holding the trust of patients and colleagues. His story is one of pain, deception, intervention, and ultimately redemption. Today, Steve will share his journey from active substance use disease to recovery, and more importantly, he'll help us understand the warning signs, some barriers to seeking help, and resources that are available to healthcare professionals facing similar struggles. Steve, thank you very much for being here and for your courage in sharing today.
Thank you, Terry. It's great to be here. I appreciate the opportunity to spread the story.
Yes, so let us start by hearing your journey that led up to your substance use issues. I'm guessing that looking back, you understand more about what contributed to the struggle that you didn't realize, obviously, at the very beginning and at the time that things were happening. So let's hear a little bit about that.
I appreciate that. My story has a few different facets to it. First one is just, where did my addiction come from? And then I go on to, maybe discuss a little bit about what it was like practicing impaired. Just recently, within the last hour, I listened to your podcast from last week talking with the gentleman with the buprenorphine.
Okay.
And I was so impressed by the description of addiction right at the beginning, his definition of addiction, and the way that he talked about it's not necessarily the drug that causes the problem. It's where we come from. Where does our addiction come from initially? And I could really relate to that. For me, I think back to my high school days. I'm 62 now, so high school was quite a while ago. However, I recall as a freshman in high school, the idea of, I was really motivated and I was great in athletics. I was good in classes, but I could not talk to people. I did not know how to communicate. And I found I saw, like he said, to other people, it's just normal. I saw all of these other people having great conversations, communicating, having, my guy friends were having discussions with girls, and I did not know how to do that. However, I found early on that a couple of beers could change how I felt, my insides, and I could become, this mischievous, this outgoing, this flirtatious individual who I thought I wanted to be. And
Sure.
I felt like, okay, this is how everyone responds. And I realized, that as long as I continued to do what was expected of me, the idea of, all through high school, the idea of continue to get good grades and participate in school athletics, do my part-time job, communicate well with my parents, with my friends' parents. As long as I continued to do all of that I could continue to get away with whatever I wanted to with regards to changing how I felt. Now, this isn't necessarily what I was thinking at the time. It just manifested.
Sure.
I've had the opportunity to review it and look back and see how it went. And so that's what became this learned behavior that I had. I learned that as long as I did what I was supposed to do and that I maintained this high level of achievement, that I could continue to change how I felt and get away with what I wanted to do. And so that was a tool that I took with me on into college. And it continued to manifest through college. The idea I participated in what I would consider high-level students do. I was a student advisor. I was on the dean's honor list. I got an intern job as soon as I possibly could. But on the other side, I continued to escalate my alcohol, and I started smoking pot on a regular basis. And the idea on the weekends would come around, and I would become increasingly mischievous and flirtatious and inappropriate in that behavior. But it was overlooked because on the other side, I was, top of the class and doing really well, and you know, living what appeared to be a strong collegiate life.
Yeah. It's kind of, my kids are grown now, but as I hear your story and other stories that are actually similar, it's really sobering as a parent to think I could have missed that in my kids. I've read your book. Your parents were engaged. You had siblings that were engaged. You had, what sounds like a very good, obviously nothing is perfect, but a very good upbringing and family. And
Yeah,
yet
agree.
they missed it.
Right.
I mean, it's just, and no, I don't mean that as a criticism to them. I just think it's, if your children seem to be performing well, you don't really ask the questions that maybe we should be asking.
That's so true. And how do we overcome that? It's difficult to have a list of 10 signs that you look for in a drug addict, right?
Yeah.
That just doesn't work because those signs come and go. They're transient. And people may experience some, people who are not using drugs may experience some of these symptoms. However, throughout the entire process, the consistency is that we as a drug addict are, as time progresses, we are living two completely different lives. One of them is the outward life where we're showing up and performing and we're doing all that we need to do to make everything look negligible, where no one's going to question us.
Yeah.
Where on the inside, we are planning, we are worried, we are ashamed, we're constantly stressing about making sure that we're going to get our next drug use. And whereas the other person, again, back to the other interview that I was listening to, you asked a question about, you've got two individuals working side by side, and I pictured, two pharmacists working side by side on the bench, right? One of them is using and the other one isn't. How do you know the difference? And to be honest, you don't, because both can be showing up, both can be doing what they need to be doing. And where I'd like to go with this later on in our talk is not necessarily how do we find out that that person is using, because you can't really find out. I'll tell you also part of my story about how I had the opportunity so many times to tell someone, but didn't. It's changing that culture. How do we change the culture so that an individual practicing feels more comfortable, feels like their life is not going to absolutely crumble and fall apart, incomprehensibly fall apart if they ask for help? How does that change? And bringing it all the way back, how do we address that in college? How do we address that in high school and middle school, for that matter?
Right.
The idea of I don't have the answer to that. It's a big question that I have, and I've got little ideas, but I'm looking for an answer for that. But to get back to the story, would you like me to continue on with college?
Yeah. And I'd also like to hear, I mean, you've touched on this a little bit, how did you manage that dual reality of being a healthcare professional while battling your own substance use? Like you said, you're every day, how did you do that?
Right. So up until, throughout college, there were 2 or 3 or 4 times when I stole some drugs from my intern positions. Not much, some benzodiazepines here and there. I don't mean to downplay that at all. It was a big deal. But still, as I got into practice, what I realized, because we are smart, because we're sharp, because we think we know everything there is to know, as a young pharmacist, I was I was sick one evening, right, 2 or 3 months into my practice, and I was working in a small community hospital, and um, and I had taken the Drexoral, I had taken the acetaminophen, the guanfacine, the Sudafed, all that we normally take to
Mhm.
help treat our symptoms because, 80s and 90s, we went to work sick. That's just what we were supposed to do. The and so I had treated myself. However, I was still feeling really sick, and I can clearly recall sitting in this. It was a small community pharmacy. My one technician was out doing rounds, and I looked up on the shelf and I saw this whole line of opioid cough medications, and I thought, I know what I'm doing. I'm a
Mhm.
pharmacist. Why don't I just
Mhm.
treat myself, and then I can
Mhm.
continue on? So I did. I picked one. I dosed myself. I double dosed myself, and 15 minutes later, I had found it. It felt really amazing. My cough was gone. I had this invigorating feeling inside of me. And I thought, okay, I now know how to do this because I'm a pharmacist. I can control it. Um, I can, the control in the pharmacy was different in the late 80s and 90s. However,
Mhm.
it was still there and we still needed to cover things up. And I became very adept at covering things up. And the idea of treating my ailments increased over 3 or 4 years, whether it was a stomach ache or a headache or I didn't sleep well the night before. It didn't matter. A dose of opioid cough medication really helped all of that feel better. And as time passed, we're 4 or 5 years into the practice, and I've moved from staff pharmacist to a director of pharmacy. And so I'm managing all of the 222 forms and the inventories. And it, for me, that made it flow more. It seemed to
Mhm.
make it easier for me to divert to myself. And,
Mhm.
one of the compounds that we did in the pharmacy was a cocaine solution that we would use for emergency nasal surgeries that we had to do. And so I had access to that, and I tried some one time, and I thought, "Oh my God, this is amazing." And I quickly started including that into the process of what I was doing. And so
Hmm.
my first 7 years was staff pharmacist, director of pharmacy. And the use continued to escalate over that time, especially the last 3 years. And I was getting to the point where, the last 3 years was specifically just what the other gentleman was talking about, that it wasn't about feeling better. It was about keeping from becoming sick. Because
Hmm.
if I would go for more than 24 or 36 hours without any opioids, I would start to get the sweats. I would start to feel uncomfortable. I would start to um, be unable to make regular decisions on what I wanted to do.
Hmm.
And all I could think about was using again. This is about, in my story, this is about the time when, from my hometown, one of my friends that I had gone to, a colleague that I'd gone to pharmacy school with, his family owned 3 independent stores in my hometown. And they had just received contract to put together a hospital pharmacy for a new surgery and maternity center that was going to be built. And they knew I was a director of hospital pharmacy. He called me up and said, "Would you like to come down, move back to hometown, be the director of pharmacy, open this up, work with me in our clinic pharmacy for a year while they're building the hospital?" And I thought this was my savior because I was going to be able to move. I would be able to start all over. I wouldn't have to
Mhm.
reveal myself to my family that what was going on because all this time I was living that, what we talked about, that secret life of managing my addiction while also separately managing my family.
Mhm.
My wife could tell that I was starting to become distant. I wasn't there regularly for the kids. However, I was easily able to put that onto the idea of being a young, new director of pharmacy with all of the stresses that come from managing that and working 50 to 60 hours a week, trying to manage the pharmacy. So when we moved, I thought, okay, this is it. I can change, the words.
Fresh start.
Fresh start. Exactly.
Yeah.
Pick yourself up, start somewhere else. It's fantastic. You get to start over.
Yeah.
Unfortunately, that's not how it works, because, we get to a different place and we're still the one standing in our own shoes, right? We get there.
Yeah.
And the difficulty, not the difficulty, the thing that happened at this new place, this new independent clinic pharmacy that I was working at, is because it is an independent shop and I was left to manage the store while also putting together the policies and procedures for the hospital, I had control of the environment, I felt. And so my use escalated significantly. It didn't go away. It bumped into high gear. And that 18 months was what the majority of my using story is about. The previous, the high school, the college was the preparatory time, learning how to hide things, learning how to seek approval. The next 7 years was understanding that I could take that, be secret. I was smart enough. I could get away with it. I could use drugs. And now I was like, okay, this is the big leagues. I'm using all the time, 5 or 6 or 7 times a day. I'm drinking the opioid cough medication, using our cocaine, hiding it, knowing all along that it's going to be found out at some point in time, that it's inevitable. It's not sustainable.
Right. Yeah. So when you were in pharmacy school and then got your first job as a licensed pharmacist, it sounds to me like there weren't any thoughts of, now that I'm in this position, I will have access to stuff. It almost sounds like you kind of stumbled on the idea of, hey, I have access to stuff. And it started with a common cold, kind of non-controls, like, let me just, whatever, pop a Sudafed. Yeah.
Very true. That's exactly how it worked. Right.
Yeah. And then you realized, oh, I could get something stronger. And so you're, having access to making the cocaine compound. And so I'll take a little bit off the top, or take a little bit of the opioid cough syrup off the top. And so people were, and you're right about the 80s and 90s in terms of it, we all knew it was controlled substances, but there certainly wasn't, I don't feel like, this kind of scrutiny around it, record keeping. I don't know. Maybe there was supposed to be record keeping.
There was some record keeping, you're right, but it wasn't. There weren't cameras everywhere. We didn't do back counts. We didn't do inventories as tight, especially on the 3s, 4s, and 5s.
Yeah, you dropped a tablet. It's like whatever.
Yeah, right. Exactly. 10%.
Not
okay,
as
that's
much.
good. Yeah.
Yeah, exactly.
Right.
When you got to then being the director and nobody was looking at you. I just told a client recently, you got to watch the director.
Yeah.
Nothing negative, that he didn't getting any bad vibes or anything, but it's just like, no one can be ultimately in charge, right? You always have to have that
That's
balance of watching everybody. Then you were able just to have free reign.
That's what it felt like. That I could have free reign. And it seemed to make it easier to cover my tracks. And however, even with that, as a director, that at some point in time it's going to catch you, because files get looked at. Right. And that's why the whole idea of moving somewhere else just seems so ideal. I could just step out, move somewhere else, and start over, not realizing that after 3 days of not using, I would feel so incredibly horrible. That's difficult to share the intensity of what it feels like when you're using high dose opioids on a regular basis, a daily basis, and then all of a sudden stop. And as we know, it's not going to, the withdrawal from opioids is not going to kill us. It's going to feel incredibly uncomfortable. But all that I could think about was continuing to use. And, so here's the thing, when I was in the middle of that practice, that last 18 months working as a retail pharmacist in this community setting. The things that were going through my mind is that I'm still showing up. I'm at the pharmacy a half hour early every day. I stay an hour late every day because I'm telling people that because I'm authentically concerned about making sure all of the work is complete and appropriate and following up on making sure the order is put in and the prescriptions are filled appropriately and everything is done. And with that, I get kudos from the owner of the store. Good, thank you. I appreciate you managing it so well, la, la, la. I also feel like I am being present for my patients, like I am counseling them appropriately. However, it's impossible that I could be because 90% of my time is focused on assuring that my paperwork has been covered up appropriately, making sure that no one is watching me when I step into the bathroom 7 or 8 times a day, coming up with excuses for allergy excuses because it's 5 in the afternoon and I'm having a difficult time reading the prescription because my eyes are so blurry. And my nose is runny. Playing all of that together. Now, during this time, I had multiple opportunities. Coming back home to my hometown, my dad was still alive and he lived here, and I had, a couple of sisters and a couple of brothers that lived in the area, and we would get together regularly, and all of them at different times would share their concern about, Steve, you're not looking so good. You stopped exercising. You are your personality is a little jumpy. You're a little erratic. And I had learned how to lie really well, how to look them straight in the eye and clearly state with them that, no, it's all okay. It's difficult because we still own a house in the town that we lived in, and we're buying a new home, and we're trying to make finances do, and I got to work extra to cover things. And the kids are just now starting, private preschool, so that needs more money. And my wife is staying home, so we want to make sure that, she's able to manage everything. Don't worry about it. I'm fine. And they would accept that.
Could they have done anything different that you think would have yielded an earlier admission from you? And
I think they could have. That's difficult. That's really difficult because I certainly don't want to put it upon anyone else.
No.
However,
Yeah.
my wife knew that something was amiss. She didn't know that I was using drugs. She thought a myriad of other things.
Sure.
But I was not present emotionally or physically, and I wasn't being an appropriate parent. So there was some, on the outside, it looked like this is what was really interesting and very telling for spouses, male or female spouse, doesn't matter, is that on the outside, my brothers and sisters and her parent, her brothers, sisters, saw her living this beautiful life. She gets to stay home. She's got a new car. She's got the kids just to manage, to take care of. What could be wrong with that? All you have to do is have dinner ready for him when he comes home. Everything will be better, However, she could tell that life was not, that I am not the same person that she married.
Sure.
Right? And when she would bring that up with my dad or with my brothers and sisters or with her mom, they would put it back to her with just what I said, the idea of, oh, just try a little harder. Just try to make things a little bit better. Just take care of your portion at home. He's working really hard.
Right.
And so had the family members listened to her, maybe they would have put together an intervention. of some kind. Because I come back around to this, and this seems to be one of the strong points in the whole story, the idea that there's really only 2 or 3 ways that something like this can end for someone. They can either have an intervention, right, where they are given an opportunity, to reach out and get help, and that can be friends and family, counseling, their doctor, spiritual, whatever, some sort of intervention can happen, or they can be institutionalized, right? They can either end up in the behavior health unit, they can get a ticket and go to jail, DUI, something like that, where they then have to address their addiction, or they can die. And unfortunately, it's spread across all 3 of those. Many people end up they can die from an accident, an overdose, suicide. It's all real stuff, and that all of those can happen. For me, I'm not sure why I was able to get it this way, but I had a spiritual intervention. And you read about that in the book.
Yep.
It was incredibly strong when it happened, and it didn't give me strength. It took away all of my strength, and by taking away all of my strength, I could no longer do any of it, and needed to ask for help.
Yeah.
And so
that's what ended up working for you. And I guess when it comes to the family members, I suppose it's easier if you've got each of them individually having a conversation with you, right? Like, Steve, what's going on? And your family that's lived with you your whole life, they don't naturally go there. Surely they would have seen signs if you had a propensity for that. Yeah. So trying to figure out, it's easy to listen and say, yeah, he's just stressed, new family, new job, working hard, whatever. But if they were all in a room together, Steve, what is going on? Then who knows what that might have ended up being. And we never know going back.
No, we never know. And they would have had to have been in a position where it's an ultimatum, or you do this or we're out, or something, because
that's hard for them too.
Me or not.
Yeah.
Right.
Yeah. Right. So you had
what I do want to share is during that time frame in the pharmacy world, I had absolutely no idea about recovery. I had never heard of the Pharmacist Recovery Program. I did not know about AA or NA. I did not know that there was a way out.
And you probably did not know that you were not alone.
Exactly. I did not know. I thought I was alone out there on my own. Why would
the only pharmacist in the world that was going?
Exactly. Right. And that whole concept of being incomprehensibly demoralized, the idea that if I say anything, I'm going to lose absolutely everything, my home, my wife, my career, my family. So I'm going to hold on tooth and nail. Right.
Yeah. I am a huge proponent of the culture in the workplace being one that sends the message that, help is available. I would love to hear if you have any ideas. And I also want to talk about, you've mentioned that I believe you did use your journey later on when you were in a position of work back in the pharmacy to help others. And so I'd love to hear about that. And I think that will definitely touch on the culture and how you can begin that process at a place of employment. But in general, do you have any thoughts on how to make the culture one at the place of employment that people would be more inclined to self-admit and say they need help?
A little bit. If it's okay, first, I'd like just to share a little bit about the amazing California Pharmacist Recovery Program. I know that each state has one. I'm not familiar with the other states, but what I do know is that they all operate very similarly. California's pharmacist recovery program it's a recovery program contracted by the State Board of Pharmacy to a third party recovery center, and they take responsibility for monitoring and putting the professionals through. They'll take an anonymous phone call. They help you identify the severity of what your mental health or substance abuse disease is, and then they guide you into the type of help that would best suit you. And what I love about it is that it's effective, that individuals who enter it are very likely to come out the other side practicing pharmacy as long as they complete the program. For me, it did a tremendous step at helping me regain, number one, my understanding that I am a good pharmacist. Yes, I was a drug addict. I am a drug addict in recovery now, but I was a practicing drug addict, but that's not who I was. That I was initially a very good pharmacist, and that I could take that with me once I learned the tools of recovery that the program taught me. I could take that with me and take it back out into the world of practice. And what I mean by the tools of recovery, we can learn tools of recovery through rehab centers, through AA, through Narcotics Anonymous, through all of these different programs. The specifics around the pharmacist recovery program is that we learn those same tools, but we also learn how to bring them back into the workforce. It's specific to help us learn how to walk back into a pharmacy, how to practice, and how to manage ourselves as individuals, as pharmacists that are in recovery. How do we talk to our fellow practitioners? How do we work with the nursing staff? So there was that end of it that worked incredibly well for me. The other end of it was the support that they gave me around the legal action that the state wanted to take against my license. Rightly so, the state of California wanted to pull my license because they didn't want a drug addict practicing pharmacy. And because when I turned myself in and asked for help, that's the part of the story that I skipped for a second.
That's true. We did skip that. That's a big part.
When I turned myself in and asked for help, that day that I had that spiritual intervention, I talked with my supervisor. He was familiar with the State Board of Pharmacy Recovery Program. We called them. The next day I was in a rehab facility. Okay. He could have easily called the sheriff and had me arrested, but instead he put me into, I agreed, I called, and they got me into a 28-day treatment program. 2 weeks into that treatment program, I knew that I needed to confess to the State Board of Pharmacy everything that I had been doing so that the owner of the store did not take complete responsibility for all that had gone missing. I wanted to try to alleviate that responsibility as much as possible, take responsibility for my actions. Okay. And by calling the State Board of Pharmacy, they came down and visited me in the rehab facility, and they had stated clearly that, yeah, your store had come up on our records. We had, the wholesaler had contacted us. You've been running too much cocaine and opioids through there. We were planning on a visit with your store sometime in the next couple of weeks. So I know that I would have been walked out in handcuffs had I not turned myself in. So with that in mind, the state knew that I had stolen large amounts of medications from that particular store over the previous 18 months. And that's why they sent me a notification 18 months into my recovery that they wanted to pull my license. At that point, I was able to take that information with me to my pharmacist recovery group with other doctors and pharmacists and dentists that I was meeting with on a weekly basis for 5 years. And they were able to walk me through the steps. Because when I got that letter, my wife and I, we were both in tears, and we thought, okay, this is over. There's no way around this. We're going to have to figure out another profession. Mm-hmm. And they helped me realize that I'm not that same person, that I am a practicing pharmacist, that I'm good at what I do, And what I needed to do was hire a lawyer and have them mitigate the process for me. And by doing so, the lawyer worked with me and the State Board of Pharmacy, and we walked right through the steps as long as I continued to do what was expected of me. Show up at my pharmacist recovery program meetings, do my random urine tests on a weekly basis, continue to go to AA meetings on a daily basis, and show up at my therapy for the next 5 years, that I would have my license reinstated fully. And so that was just on me. That was put back on me, and the pharmacist recovery program helped me get through that. So that's my plug for that program, that
Yeah.
anyone, as long as you step into it, you agree to the terms, you can get help. We can get help, and we can get through the process and come out the other side as a practicing pharmacist. And frankly, come out with such a new understanding of what it's like to practice pharmacy. It is so incredibly freeing to not need to worry about all of these other things that we had been worrying about that I had been worrying about for so many years. Where I'm going to get my next drug, how I'm going to cover up the documentation, keeping my stories straight. All that I have now is the truth. When I talk with someone, this is what's happening. I don't need to think back about what I told the last person. Right?
Yeah, I'm sure it does feel, yes.
Everything just goes the way it's supposed to.
I'm sure it does feel very different.
So taking that into regular practice makes an incredibly difference, especially with the people that I work with. And
Right.
I've always had the impression, the feeling walking into a new pharmacy now. I haven't had many. I got my one position at the hospital that I worked at. I was there for 25 years, and then I retired from that, and I've been in a new position now for 4 years. So just the two positions I've been in.
Mm-hmm.
But the first one, I was as open as I could, as the other employees wanted. When first starting, I'm working with 10 other pharmacists and 15 technicians, right? And so it's a small town. Everyone has a good idea, and they all know that, oh, here comes Steve. He used to work in town. He was a drug addict. He went to the local recovery facility, and now he's coming back to work with us, right? But, what are we going to do?
I'm watching you.
Exactly. And so it's up to me to not care, to not worry about other people watching me. I have no business what other people think about me. My job is to show up, do my job to the best of my abilities, answer the phone first, because that's what we need to do in the pharmacy, is pick up the phone right away. No one likes to hear the phone ring twice. And to be open to questions. If someone, during the course of a few months, I had the opportunity to be one-on-one, to work, as shifts change, how it works. You get the opportunity to work with all of the other individuals at some point in time. And some want to talk, some don't. Some just want to see that you're going to show up and do what you're supposed to do. But to be present for all of them at different points in time, and if they have the slightest little question, to be open to talking about it with them.
Yeah.
To hearing what their concerns are, to answering their questions without taking any of it like they're judging me or being personal in that process.
Yeah. Well, and being very transparent, I would guess. I mean, when it comes to witnessing waste or checking compounding, and, I mean, I can only imagine that I would be very self-conscious that it's like, okay, pocket's clear, it's like, here, watch me do this.
Oh, yeah.
Yeah.
No, I had some experiences like that, and going through the emotions of letting the director or the other pharmacist or whoever it was, or the State Board of Pharmacy one time. On the other side, though, you had asked about the idea of working with patients and other staff that may have had controlled substance issues. And one of the things that I did, not knowing specifically if I was going to if I was going to get my license back or not, in my first year in recovery, I went to a 1-year certification program to become a drug and alcohol counselor. And it was just at the end of that year that I was able to start a part-time position working in a pharmacy. And so I had that skill set that I took with me. I never opened a practice. I never started working directly with drug addicts. But at the same time, being in the community and working in a clinic pharmacy, an outpatient pharmacy for a hospital, we had this 4-story building that was full of offices, and we had patients come down all the time. And many of them were patients that I knew from out in the community, from going to meetings, AA and NA meetings. And they would come through to visit with me just so that they had that one professional contact who knew that they were also in the program, so that I could work with them specifically with their prescriptions. With staff, it was interesting because there were a couple of situations where I worked with staff, but they were very much like me in that it wasn't necessarily me who, I didn't talk them into going into recovery in any way, shape, or form. I knew that they were not right. I knew that they were having a difficult time, and they would avoid me because they knew that I was in recovery and could pick up on what they were going through.
Okay.
And 2 different times over the course of my career, people who had been practicing at the hospital were caught in diversion, went through recovery, came back out, and then they came and talked to me and thanked me for what I was able to provide for them, even though I didn't really realize I was providing anything for them.
Interesting. They knew that you were in recovery, and so was it something that you had said, like, did you contribute to a culture of it's okay, things can be okay?
That's
Get help?
that's a good segue into this process. Yes. One of the things that I'm working on right now, and one of the commitments that I have, is to be open and always try to make it available for people to talk about what's going on. And by doing that, I find that by sharing little bits of my story first, that allows someone else to come forward with their story. Many times they don't want to come out with part of their story. But really the only direction that I understand that we can change the culture of how drug addiction is seen in institutions in order to help provide a situation for healthcare providers to come and ask for help early is by changing the story, being able to talk about drug addiction the same way that we talk about our cholesterol or our blood pressure. It needs to be an open story. And by doing that, we need to search out the practitioners in our institution that are in recovery, currently having the best practice of their life, and encourage them to come forward in whatever forum we have for them to come forward in, whether it's through newsletter, whether it's having a meeting, an open forum, an open discussion. I have yet to see that happen anywhere. However, I practice in a small little town in Northern California, not in one of the big cities. Are you familiar with that happening? The culture changing? Have you seen that?
Yeah, I mean, it's something that I definitely emphasize
Yeah.
with facilities, and I think it varies. I have definitely heard of places where they do have their, kind of poster person who has been through it and is willing to, it's out there, that this person is, it's not necessary they've made an announcement or anything,
Yeah.
but they're definitely there are people within the institution that know there is this person, this nurse or physician or what have you, and
Yeah.
they're willing to talk. And I have heard that people have come to them and, ask questions and when they're struggling, and they have used that as an avenue. So it does happen. I don't know how prevalent it is. I kind of see it as a multi-step process,
Sure.
right? I
Right.
mean, when I talk to people in general, a lot of people don't even know what diversion is and certainly don't think it would ever happen with a healthcare professional. So I think that that is the first part of the education, right? Is people need to be aware of it
Right.
and that it does happen. And that it also doesn't always look the same. I
So
think,
yeah,
you
my
had
my
mentioned, you
the
had
the thought,
mentioned that you, sorry, go
no, go
ahead.
ahead.
You go. You
The
go.
there's the structure, right? There's the culture, but then having one individual as great as a poster child to create the awareness. However, we need to have a structure and a policy to back it all up. The idea that an internal alignment with our employee assistance program, with our
Mhm.
human resource department, with our leadership, so that everyone is on the same page. Everyone
Yeah.
understands the idea about recovery,
Yeah.
as well as an external alignment with our medical assistance programs, whether it's the nursing program or the pharmacist recovery program, so that we have our internal recovery program matches the external program.
Mhm.
I don't know if that makes sense. The idea being that if someone wants to receive help and they haven't yet caused any patient harm, and
Mhm.
they come forward and they confidentially request help from, they need to know who specifically they can request help from, and that needs to be advertised, whether it's their supervisor, their employee assistance program, one of the
Right.
senior executives. Who can they go to request the
Right.
help? And once they do request that help in their intake, they realize that in their intake that they are going to part of this requesting help requires them contacting their assistance program, whether it's
Mhm.
nursing or pharmacy or doctor or what have you, or medical,
Mhm.
whatever that particular state program is, and that state program and our own employee assistance program or human resource department need to have an open line of communication,
Yeah.
so that the requirements for return to work pathway are the same.
Yeah.
And that needs to be
Yeah.
written down in policy. That needs to be clearly written out in a policy somewhere, so that we as employees are able to evaluate it, look at it, and see what's going to be required of us. Also knowing clearly that because it's a confidential, that doesn't mean it may be consequence free. There still may be consequences, especially if in our intake we say that we have taken drugs from the hospital, that we have
Mhm.
taken drugs from the Pyxis. We swapped out drugs for a patient. We took the Norco and they got Tylenol.
Right.
That
Yeah.
there will be consequences also. However,
Mhm.
we will get you help. And if you follow all these steps, there is this return to work pathway, as opposed to, oh, as opposed to you ask for help. Okay, you're never working here at our facility again. We'll get you
Mhm.
help, but you're not going to come back here.
Or even just you're fired.
You're right. Oh yeah, exactly. Don't worry about it. You're fired.
Yeah, we're
Go
not
get your own
gonna,
help. You're
yeah,
not going to be here.
go
Right.
figure out yourself how to get help,
Yeah,
right?
exactly. Right.
Yeah. Yeah, one step at a time. Yeah, no, I agree. It's there need to be consequences, because I think that consequences also help the recovery process. I mean, if there aren't consequences, then I don't know. I feel that there would be less of a chance that there would be that sustained recovery because it was
Right.
just too easy. And I mean, a facility can have a pathway for reentry, but it doesn't mean it's a guarantee that
No.
somebody is coming back. So it's, one step at a time. But if they at least know that the facility understands and will first and foremost try to get them help and then deal with the rest of the consequences and what happens after. But, they truly want to get them help, and that is their primary objective.
So one of the barriers that we face right here is that just everything that I went through, the idea that people are going to bring it up. They're going to put out all of these concerns for you, and you're going to, and I'm going to deny it all the way along. There's nothing wrong with me. I'm just fine. I can do this, regardless of what sort of diversionary tactics I put into place. Because we focus very strongly on becoming incredibly efficient with our diversionary tactics that we're putting in place.
Mm-hmm.
And as we know, there are still ways around them, and it still happens. People may get caught much more quickly. They may go to the streets to get their product illicitly, but people still practice impaired.
Mm-hmm.
And understanding how to move around that so that we are able to create that environment where, even if it's just 2 months earlier, if they can request help 2 months, 3 months, 6 months earlier than they had before,
Yeah.
it would be fantastic.
Yeah, I agree. I agree very much. Well, Steve, I want to thank you very much for being so open about your journey. And I do. One of the reasons that I enjoy having people on the podcast that are in recovery is because I do think that it is good for the professional community to hear more of these stories. I mean, whether people believe that reentry should be available to those in recovery or not, I think it still helps to humanize the journey and just realize that, I mean, it's a disease. It's not something you set out to do in your practice and it caught up with you, but there is hope on the other side, once that help is given and going through that whole treatment process, and the results can be fabulous.
I have to share too that I agree that without going through the recovery process, I would not have had the last 30 years of absolutely amazing practice.
Yeah.
Where I've gotten to do, just be the involvement that I've gotten to be present for with regards to program development for meds to beds and bedside counseling and medication reconciliation and patient education, all these different things that I would not have had the opportunity to participate in had it not been for the opportunity to be recovered.
Right. Yeah. That's great. Okay. Thank you very much, Steve, for your time. I really appreciate it.